On this episode, we'll talk about muscle cramps. We'll also talk about eating solid food the day before surgery, and we'll also talk about the recovery time for high-impact sports. Hello everyone and welcome to the Ask Dr. A show. This is episode 39 and I'm excited to be here with you. Thank you so much for submitting questions, and this show has been going on and for months now, and I'm very excited that questions are endless. So it's just a pleasure to be able to help out people out there, patients struggling with minor stuff here, but we're always here to help you. So thank you so much also for all my patients that are following me on Snapchat. For patients from other doctors, you're also welcome to do so. My username is on the screen here. Welcome to add me on Snapchat. That way you can have me directly linked to my phone, and we can chat, and you can follow my day-to-day things that we do. All right, so let's get into the show.
What can I do if I'm experiencing cramps in my legs and hands?
All right, so muscle cramps or muscle spasms are, number one, not normal. So you need to figure out what is causing the muscle spasms. There are two causes which are common. Number one is dehydration. So that's the number one cause in gastric sleeve patient that does not focus on being hydrated or is struggling getting hydrated the first few days or maybe weeks after surgery. As the swollen tissue comes down, you're able to intake more water at a time. It's easier to get hydrated, and those muscle spasms or cramps go away. The other thing is a lack of potassium, and this you'll have to check with your doctor, get some blood drawn, make sure your potassium level is at a good level. Some of the medications for the high blood pressure, if most of our patients have high blood pressure or diabetes, but especially high blood pressure, there's some medications that may cause you to go to pee more frequently, and may lose a little bit of potassium at the same time. Those patients may have some muscle cramps more commonly than other patients. So take-home message is focus on hydration is the number one thing here, and if you're taking some other medication, especially or specifically for high blood pressure, check with your doctor.
Can I eat solid food the night before surgery?
All right, so this answer may vary from patient to patient or surgical practice to surgical practice. In our practice, you may not take any solid food the day before. Vast majority of the patients, depending on the BMI, will be required to do a pre-op diet to shrink your liver before surgery. This helps a lot at the time of surgery. Two, number one, shrink your liver. Number two, have enough space to perform your surgery. Number three, get your mindset, psychological aspect in the same mood that you're going to be in, that you're prepared mentally, that after surgery you're going to be doing a post-op diet based on liquids, and you're going to be just fine. All right, so most of our patients are required to do a pre-op diet based on liquids. So no, people don't eat any solids the day before surgery. Now, this is our practice. You may be doing a special diet that we've done also before, especially on some patients that can't do the pre-op diet the way we intend to because of a certain situation. But it may vary from practice to practice. Check with your doctor. In our practice, 99.9% of our patients don't eat any solid food the day before surgery or days before surgery because they're doing a pre-op diet based on liquids.
If I did my surgery this summer, can I play football in August?
All right, so let's talk about high impact sports and their recovery time. In this case, the patient is asking that if they get surgery done in June, July, and is he going to be able to be ready for football season in August? So high impact sports, football, boxing, karate, martial arts, etc., may take up to a month to recover completely, all right? So I tell patients, yes, you may do that after 30 days. Start slowly after 15 days, start walking, exercising, and build up your cadence from there up until you're 30 days out. You're able to pretty much do any type of exercise, even high impact sports. So that's it for episode 39 of the Ask Dr. A show. Thank you so much for submitting your questions. Don't forget to use the hashtag AskDrA. And question of the week, I want to hear from you. Did you experience muscle cramps after surgery? Yes, no? Answers right here. It's a good poll. Let's see what turns out. Thanks so much for tuning in. Don't forget to subscribe. I'm Dr. Alvarez from Endobariatric.com, where we are changing lives one sleeve at a time. Goodbye.